And today I will be talking about race, socioeconomic status, and how education level impacts on mental health. I want to start off by talking about the differences between race and ethnicity. They're often used interchangeably, but they are actually different things. Race is a made-up concept, but we have assigned real-world implications to it in accordance with the Thomas theorem. However, ethnicity is real, and this can serve as an important identifier. However, we have conflated the two. We often use them interchangeably, which can create problems when we ask people how to identify themselves, which I will discuss more in a little bit. And this can especially become a problem as the United States is a race-based society, even though we don't like to admit that very much, but we are still very much dividing ourselves based on our race. Next, a person's socioeconomic status is one of the best ways to determine a person's health determinants, regardless of their person's place in the world. So regardless of where they exist, they could live in India, Canada, the United States, their socioeconomic status is going to be one of the best ways to determine their health determinants. So it's important to understand a person's socioeconomic background and how it affects other aspects of a person's life. For example, a person who is working 40 hours a week for minimum wage is not going to be able to budget for unexpected medical problems that may occur, as opposed to someone who works the same number of hours but is also receiving health insurance and has sick day policies. So if a person doesn't have time to get time off when they're sick, doesn't have time to take care of themselves versus someone who does, that's going to have very different health outcomes, different ways of reacting to different things that come up in life, and various problems with that. Also, there are different cultural ways of addressing mental health. So all ethnic groups have different ways of approaching mental health and the challenges that come with treating it. So a person's culture plays a significant role in how a person views their mental health. Some people view mental illness as some sort of possession by a malignant force. Other people will say that those who are suffering should just remember how good they have it and to stop complaining about something so trivial. So others approach it as a chemical imbalance that deserves to be addressed. It's important to understand that a person's background is going to play a significant part in how to treat their mental health. None of these views are less valid than the others, but they do shape how to approach treatment. These are all different views that have been expressed through different points in time by different cultures, and are still being held by different people today within the United States. So I wanted to make sure to mention that. Again, they're no more or less valid than others. We do know that they are chemical imbalances and stuff like that, but how a person chooses to go about that and how they choose to go about treating it makes a difference. So now, moving on to my problem statement. So this says, there is a reluctance by racial groups to receive/talk about their mental health. This lack of discussion has led to a generational stigma of mental health, preventing those who need help from seeking it. Those who experience poverty or financial stress are also probably under greater levels of pressure, which leads to mental illness manifesting/being triggered. It is important to understand what this relationship is so that comprehensive treatment can be developed in order to address the problem. Now on to my hypothesis. It's well known that different racial groups or ethnic groups have different views of mental illness. This could potentially be linked to their education levels. If a person is denied the ability to pursue higher education or is not able to receive quality education from a young age, they may not know how to either cope with negative life events that can trigger mental illness, or if it happens organically, what to do then. So now moving on into my literature review. So Like I was saying before, the categorization of people into racial groups in the United States is part of our race-based society that we still exist in. And race actually in the United States is not a stagnant thing, especially since it is made up. It actually has changed on the census every year, every 10 years since the census started in 1790. So we are constantly redefining what race means, but we are still assigning consequences to the race, even though we're constantly changing what it is. So racial disparities in health are directly linked to disparities in socioeconomic status. So like I was saying before, SES, or socioeconomic status, is one of the best ways to determine health outcomes. But racial minorities have a harder time improving their socioeconomic status because our society has found ways to keep them from improving their lives. This can be seen through redlining, doctors not believing different groups when they come in saying that they're experiencing problems, just various things. And I'll talk some more about some of these details further on, but these are just some examples to keep in mind. Also, different racial and ethnic groups have had different levels of success in the United States, which has also created different socioeconomic classes and therefore education levels. It is also important to know that for every dollar made by a white person, a Latinx individual makes 70 cents, while an African American individual earns 59 cents. And again, I am not looking at gender on this, and I'll explain that later on. To go a little bit deeper into this, Latinx communities around the country have different histories, so they have different rates of success. So for example, many Mexican individuals have settled in the Southwest, where they have typically taken on lower paying jobs, which has created some stigma, and there's a lot more struggle going on. They're trying to overcome a lot of that. But for example, in Florida, where a lot of individuals of Cuban descent have settled, they are actually seeing higher levels of socioeconomic status because the Cuban individuals who came here in the 50s and 60s were typically middle to higher income families who were fleeing during the Cuban Revolution. So knowing where a person was coming from before plays an important role in understanding their success and what happens with all of that. And then also, employment is obviously going to be a very important factor in this, but not all jobs pay the same or have the same satisfaction level. So we've all heard the saying, if you love what you do, you never work a day in your life. But if someone isn't passionate about janitorial work, but that's all they can do because that's all someone thinks they're capable of doing, they're going to be very dissatisfied. That's going to take a toll on their mental health. So that's going to mess with their mental health a lot. Moving on. This is kind of tying back to what I was saying before. So if a child is growing up in the middle of a dangerous neighborhood or is close to factories or they don't have enough money to buy healthy food, they're going to be under a lot of stress, which is going to cause a lot of problems, health problems. Women in these situations are much more likely to give birth to underweight kids, which is a known predictor of future health and development. So we know that low birth weight rate can be indicative of future health problems. It's not always a guarantee, but it has been linked through research and everything. So because of this, and again, these are typically people of racial and ethnic minorities, people are constantly trying to reframe this stress. They're trying to cope with it, so they're either trying to look at it positively or negatively. So positively is they're trying to say, I'm making do with what I have, like I'm doing the best I can. Or negatively is they're kind of giving up on life, they're turning to drugs, alcohol. It kind of depends on the person and how they choose to go about addressing it. So this was really interesting. Even how a person sleeps can be impacted by racism because of how stressed it can make them. So race-based stress can impact how long and when a person stays asleep, in addition to the overall quality of the sleep. So this will put an even greater level of stress on a person's body, because if you don't sleep well, then you're not going to be able to do well in school or at work, and then you're going to be stressed because you're not doing well, and then you're going to stay up late at night because you're not doing well and you're thinking about it, and just creates this cycle that it's going to be even harder to break, because it's just so hard to break out of it, because you might be able to control something, but you can't control people's reaction to what you look like. That's the basis of racism, basically, is people are constantly trying to prevent reactions to that kind of thing. So that kind of thing hasn't been talked about a lot, but it's worth noting that something as simple as sleep is being impacted by this. But it can basically cause bodies to break down faster, because they just can't handle the stress of trying to stay up and trying to address the stress that is coming along with this. Okay. So for my last slide of my lit review, all racial and ethnic groups have different ways of approaching mental health and the challenges that come with it. So, like I was saying at the beginning, there are people who think that it can be a possession, or it's really not that bad, you should just suck it up and deal with it. Others know that it can be a chemical imbalance and that it needs to be addressed. However, all of these it still needs to be addressed regardless of what you believe is causing it, because if a person isn't able to succeed because of it, their overall health will suffer. And the mental health of a community should be taken into account, because if an entire community is starting to suffer because of the effects of racism, or their socioeconomic classes bringing them down, or something along those lines, that needs to be addressed in the same urgency that other public health issues have also been addressed, such as getting seatbelts into vehicles, and that saves lives and that improves the quality of life for so many people. Okay. Now on to my methods. So there were some significant gaps in the research that I was looking at in regards to the cyclical effect that forms when looking at race, socioeconomic status, education, and mental health. I wasn't surprised by that, because I know that I was looking at a very broad topic, but I knew that there would be some, but the amount of gaps I was kind of shocked at. So I decided to kind of narrow things down by looking at mental health, education, socioeconomic status, race versus ethnicity, race impact on education, socioeconomic status on education, education impact on mental health. Anything that wasn't from the US, I filtered out. I tried to keep things to about 2000, not really before, because just how we've changed how we talk about mental health and race and all of that has changed a lot in the last 21 years. So I didn't think it was going to be especially helpful for me to look past that. So I also created a sample survey of, if I had sent out a survey, what I would have done. That's going to be included in my appendix. So I would have included a variety of people, including university students, faculty, people from different professions, and a range of age groups. And this would also have been targeted to try to reach as many people from different ethnic groups as possible, so that I could try to get as clear a picture as possible. So again, you can see that in my appendix section at the back. For my results, people have better health outcomes when their cultural, ethnic, and social differences are considered. This shouldn't be too much of a surprise. Um, the neighborhoods that many minority groups have been forced into are often rife with violence and pollution as a result of environmental racism. And again, it shouldn't be a surprise that the students who grow up in these areas are more likely to perform poorly because there's just too much going on at home for them to be able to focus on studying. So they're not really being set up for success if there's stuff going on at home that they have no control over. My findings also showed that individuals who have a lower socioeconomic status face stressors that other individuals who make enough money for their needs just don't face. And even within the same education groups, which should theoretically have eliminated health disparities, there is still significant health disparities caused by race. So even if someone's working really hard to overcome all these negative stereotypes, there are still going to be people who judge someone unfairly because of their race, and that's going to cause their overall health to go down. And it's going to impact their wages, and that's also, again, going to impact their ability to take care of themselves. Moving on to the discussion. So I was saying that there should be efforts to understand the differences that exist in various communities that coexist within the United States. So there should be a broader cultural understanding of the different ways that these can be addressed. So for example, many Latinx individuals identified specific cultural values, such as respeto. I hope we already said that correctly. That has a strong sense of honoring one's elders and sacrifices that were made for them. So a lot of people in those communities will live very close together, if not in the same house. So if you do go seek counseling and you're part of that community, there are going to be stressors that come from living so close to all your aunts and uncles and grandparents. But if your therapist doesn't understand those challenges, but also the benefits of living with that, it can be difficult. So it's better to have more people who can be aware of those kinds of backgrounds. So, like I was saying throughout this, racism affects a person psychologically, so steps need to be taken to address the way that a person responds to these stressors and the actions that have been taken in the first place to cause racism. We should be promoting cultural understanding within schools so that students can be engaged with their education. So these students who might be experiencing barriers because they're not feeling supported at home because of the different things I was saying before can be motivated to do well. And then again, cultural understanding just goes a long way so that students know that they are supported and that school can be a safe place for them. So like I have said before, this was a very broad topic that I think I probably would have refined down a little bit if I had done a survey or some other type of more in-depth research on it. But I do really think that since all these areas feed into each other, they should be studied in tandem. Because everything that I've been seeing basically since I've started studying public health shows that they all feed into each other. So they should be studied together. I also did not look at sex and gender as I felt that these topics deserve their own research paper. There's just a lot to unpack there, and I just felt that it would be more distracting to add that onto this. So that is also important. It should be part of the conversation, but I did not include that here because I just thought it would be too much. Now on to limitations. So there were some gaps in literature, like I said, especially in regards to like some of the anecdotal evidence about how Black and Latinx communities don't trust therapy. I've heard a lot of stories from friends who are part of those communities who have told me that they personally don't go or why their families have discouraged it. So I was expecting to find more research on that, but I didn't. several of my surveys that were targeting people from other cultures who have different languages as their first language were conducted only in English, so I thought that was kind of exclusionary, could have been conducted better. I didn't realize this until I was like analyzing all of this, but Native Americans are left out of almost all the literature that I found, which was concerning once I realized that, since they should be there, but they were not included. So that's a huge section of the population that should have been included in this. And again, articles in regards to how education impacts mental health are few and far between, but that there are also anecdotal stories that I've been told, and like in classroom discussions and things like that, about how people's education levels do impact mental health. So I was expecting to find more on that. So for my recommendations, I broke it down into 3 things. So in schools, I thought that there should be more community efforts to promote cultural understanding. Groups can come together to provide support for families who are struggling. So in communities that are identified to have a lot of families who are just going through a rough time, there can be support groups for those parents or guardians, whoever is taking care of the kids. There can be people that come in and talk to those parents, brochures that are laid out with all the other school supplies, so parents may feel less stigma about picking up a brochure about counseling services when they're also picking up when the next PTO meeting is. So things like that, small steps so that parents can get that information so that they don't feel that same stigma, can go a long way. Next, since this was something I just talked about, surveys need to be more accurate and represent the entire population. So, for example, leaving out Native Americans in basically all of the surveys that I was looking at is not acceptable and shouldn't really have happened. So these surveys need to be providing a clearer picture of the needs of the country and need to be accurate. And then the government needs to be part of both of these 2 surveys and schools. So funding from both the state and federal governments to help schools and surveys will go a long way in ensuring these efforts will continue. So identifying schools, communities that need the help, providing funds to surveys so that they can go in and do research opportunities. Yeah, so we need to, all of these need to be working together to make sure that communities that need help are getting the help that they need. And like I said before, here are the sample survey questions. They're also in my paper. But that is it.